Ladies and gentlemen, welcome to the MedTech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So today on the MedTech Impact Podcast, we're delighted to be joined by Orahn Preiss-Bloom, Chief Innovation Officer of OSSIO. Orahn, welcome to the show.
Thanks, guys. Thanks for having me.
Well, super excited to have you on. You were across and part of our big event last September where we brought everyone together at Med Device Boston. An amazing panel discussion with Leslie Storms, Scott Sigman. And so you have a great story to tell. You guys are doing some exciting stuff at OSSIO. But before we get into all the exciting stuff, we do like to set the stage for the audience. So could you please tell us, what is the big problem that OSSIO is looking to solve?
Yeah, thanks, Richard. First of all, it was a great panel. Thanks for organizing it. And I would say that bringing together clinicians and kind of existing industry and startups all together is just a winning combination. So it's a good job on that. So OSSIO, yeah, this goes back about 15, 20 years to the biomechanics research that I was doing way back when at Columbia University in New York. And we were studying all kinds of metal constructs in the field of orthopedics. Now, as you test these constructs of metal fixation of bones, you find over time that the metal basically beats up on the bone over time. And this is an interaction that bothered me then and bothered me for years afterwards. And when you look at the research, you look at what actually results from the interaction of metal fixation implants and bone, you see hardware removal surgeries, you see pain for patients, you see discomfort. You see sometimes the metal becomes loose in the patient. There's a whole series of complications that can result in additional adverse events or pain for patients down the line. And of course, additional cost for the healthcare system if the surgeon has to go back in and get that hardware. And as many surgeons have told me, nobody looks good taking out hardware. It's much easier to put a metal screw into bone than it is to go back in and take that screw out of the bone once the bone has grown up over it. So it was a problem that called out to me already for quite some time.
And so it's just always fascinating to me when we think about orthopedics, because I imagine this toolkit that the surgeon maybe uses, and if an external person was to look inside that toolkit and go, wow, those are some of the tools I use at home, a hammer or chisel, it's a pretty aggressive procedures that they get involved with. And so you're talking about that wear and tear. You understand, because when you're introducing foreign objects, metal into the human body, there's obviously potentially going to be a clash of systems there. So when you're thinking about these procedures, is there sort of a specific use case that you're sort of narrowing down on and you're thinking about that mechanical application or moving away from that mechanical application?
Yeah, it's actually a fantastic question. And exactly as you said, I think Dr. Sigman would always say that orthopedic surgeons are going now from carpenters, which is what they were historically, to much more biology. And that's a transition that's kind of going on, including OSSIO, but also much broader than OSSIO. And so, right as we were getting started, obviously coming from the engineering side, not from the clinical side, we had to learn what would be the best use case for the technology. And that was one of the reasons we started in foot and ankle surgery, just because of the numbers. The hardware removal rates in foot and ankle surgery are quite high, depending obviously on the specific type of surgery, but they could be in the tens of %. Whereas in some of the long bone surgeries, it might be 5% or even less. So we wanted to focus on an area where there is a demonstrable clinical problem. The statistics bear out that there's a problem here. Let's come and solve this. You will never need to remove this. So that was kind of a pretty clear first target, again, just based on the numbers.
It's such a fascinating space, Kyle, because when we think about trying to look after patients and how related everything is to mobility and this ability to make sure people are moving and staying healthy. And so again, the orthopedic part is maybe looking about how we recover from injuries predominantly, but actually the fact that as you get older and there's breakdown in our bones and our skeleton, we need to have a better system of looking after people. And again, having mechanicals is a pretty aggressive and invasive way of doing that. So if you can find any way that's less invasive, in terms of how we support the patients, it's so critical.
Well, absolutely, especially when you're talking about, Richard, the removal side of this. I know coming from an athletic background, now I've been so fortunate, Orahn, that I have not had to undergo a serious surgery or if experienced kind of a compound fracture of some kind that maybe would have required some sort of screws or implants or something like that. I am super curious though, because I did actually, my niece went through this recently where she had to have the screws removed, and I didn't really hear of too many challenges and problems. And in fact, it sounded like it was pretty common practice, to have these screws and plates put in for the healing process and then eventually have them removed. So maybe if you could, I'd like to get a little bit more granular here on the exact problem, right, that these patients are experiencing, and maybe even kind of what the solution looks like today.
Yeah, no, it's a great question. So it takes us a little deeper into the segmentation when we look at the different markets, right? So obviously there are going to be places where we would come and say, wow, like you have to use OSSIOfiber for this because otherwise you're just getting into worlds of trouble. An example that jumps to mind is if you're putting in a total ankle replacement, actually, and you have the bone next to the implant is now going to be put under a lot of stress from that total joint replacement. So you actually would very much not want metal implant in there because now you're taking stress and you're actually amplifying the stress by having now a metal sandwich on that piece of bone. And you've historically had issues with stress risers and stress fractures in that space. So that's one area where it's become a no-brainer to put in OSSIOfiber because now the OSSIOfiber will just reinforce that area without now creating the extra stress. A lot of the midfoot you're talking, about I know you play hockey, so a lot of the midfoot injuries that you'll sometimes see in hockey players. Also, if you could have, for example, a stress fracture, you wouldn't even necessarily want to put metal into a stress fracture. Sometimes you'll just say to the guy, hey, just don't put any pressure on it for 6 months, for 9 months until it heals, because you're not going to want to have to go through all the trouble of opening up, and then what's going to happen to the implant afterwards? Is that going to create more stress in the system? And so for example, navicular stress fractures or fifth metatarsal stress fractures, those are areas that we've really focused on where we have a differentiated clinical benefit. But coming back to your point, there are areas, just say bunion repair. Now, the majority, even the vast majority of bunion repairs with metal implants go well, right? I mean, I don't know if it's 90% or more, but let's say a large majority actually can be quite successful in the hands of a good surgeon. And so that's a perfect example for what you're talking about. So it wasn't a disaster before, it was okay. But if you go today to a patient and you say, hey patient, do you want to have metal in your body after this heals, which will take 2 to 3 months until the bone heals, or do you want it to go back to your natural bone? It just becomes a preference. And the vast majority of patients that we ask will come back and be like, oh, I definitely want it to go away so I have my natural bone back. So I would say that our scope of activities goes from areas where you must have OSSIOfiber to areas where you'd prefer to have OSSIOfiber. But that doesn't mean that they're not going to be surgeries where in the hands of a skilled surgeon, the patient will do well with metal. Obviously, there are surgeries like that.
Okay, so that I think answers my question. So, because I guess my question might have been around not just maybe temporary implants, right, to help with the healing process, but it sounds like some of the comments you made are around even more permanent types of implants that might be required. So I think this is really interesting because now I'm really curious about Ossio and your OSSIOfiber and really what that looks like, how it works, and those type of applications in which you're using the OSSIOfiber in.
Yeah, sure. So our goal is really to have mechanical strength that is sufficient for bone fixation, which has been a bar that essentially no non-permanent material has been able to clear until now, and yet have it go away. And that's kind of the technical challenge that we had to overcome. And so, because bone, in order to heal, it has to be held together. And in order to hold it together, you need something that's actually stronger or stiffer than it is, so that when the stress of the body comes on that system, the implant is able to withstand that stress. And so we were able to create the OSSIOfiber technology, which is many mineral fibers, the fibers made out of things like silica, calcium, magnesium, etc. None of which are materials that we went into a laboratory and mixed up and made a brand new chemistry. These are all things that have been used before in bone filler type products just to fill voids and whatnot. But we have this new form factor of the fiber, about 10 microns, give or take, each fiber. And you have thousands of these fibers packed together in different formations, and that's what gives you the strength. And so that concept is another concept that we adopted from other fields. For example, how today they build airplanes or helicopters or golf clubs is with composite materials, with carbon fibers. Now, obviously, the way you work with them is a little bit different. And carbon fibers, you can do a single layer. We need to have redundant layers because it is something that goes away over time. But we built this fiber infrastructure, and that forms the backbone of all of our products to give you that strength for fixation, but then over time to allow the body to grow into the fibers and remodel them into the bone.
Absolutely fascinating. Is there any element, and I ask this question because we've had Brian Hess on from Rev Bio, and they're sort of looking at their tetranite substance, which I think, it's a sort of similar concept. And so I'm wondering, is there any element of biomimicry where you're looking in nature to sort of inform how you're applying this, or are you taking a different approach?
No, absolutely. Yeah, no, it's a great point. So yeah, so actually almost all of our native tissues have some level of directionality to them, right? So like something like a metal or a plastic, typically it's a block of material, right? You can take a chunk of metal and make it into a certain shape, and it will always have the same properties no matter how you got to that shape, essentially, right? It's called its bulk properties. But in the body, whether it be bone or tendons or ligaments or cartilage, everything has a directionality to it, which informs or is informed by and informs its function in the body, right? So a ligament obviously would have fibers running throughout the ligament to give it the strength for that ligament. So we kind of adopted that kind of thinking. And when we build an implant, we have to think about what kind of forces is this implant going to see? Is this a suture anchor that's going to be pulled on by a suture, or is it a screw that needs to hold two bones together, or is it a nail? So we actually look at all the forces that are going to hit that implant going in, and that's how we think to build it. And that's basically what the technology of the company is. It's that thought process of where you need to put the different fibers to make this work.
Okay, Orahn, so super curious here. I'm curious about the development, of these fibers. And I'm curious, how you went about validating these materials to prove that, it could kind of fuse and grow and become one with the bone. Could you tell us a little bit more about how you did that?
Yeah, I actually think for all aspiring med device entrepreneurs who may be watching, this is kind of an important piece here, because getting any truly new and novel technology to market these days is going to take a major regulatory effort. The joke we have internally is that if metal implants would have come to market now with FDA, they never would have been able to get approved. And it's probably true, because the standards of the regulatory bodies have gotten higher and higher. Now, for us as consumers, as patients, that's generally good news, right? There's no more snake oil making it onto the market. Things are generally well regulated. But as medical device people, what that means is that you need to be really buttoned up by the time you make it into the regulatory agencies, whether it be FDA or in other countries. And with OSSIO, it actually took, I would say, even a couple of years to figure out the supply side of the business to be able to get to a situation where we could get the raw materials we needed at the quality we needed to be able to get the ball rolling. And then obviously you do your proper development, which sometimes can happen more in a university setting. It doesn't always have to be in the company setting. In our case, it really was more in the company setting from day one. And we tried different types of fibers, different geometries of fibers, et cetera, until you found something that felt like it worked. And obviously you look at literature to see what other people have done to try to get a feel for what might work. You don't just develop into a void. And once we had the mechanics that we were looking for, we started going into some animal models. Now there too, before you start launching into major multi-year animal studies, you need to do some of that initial work with shorter pilot studies, for a number of reasons. First of all, we obviously need to be respectful of the number of animals that we use and try to minimize that. But also, just in terms of your iteration for design, you likely will discover things in those early models that will allow you to fix aspects of your product or to improve aspects of your product before you get to the big regulatory studies, which are very costly and can be hundreds of thousands of dollars, if not more. So we had that. Unfortunately, we had a couple of very good people that we were working with, like the histopathologist and the toxicologist. And a talented histopathologist and toxicologist, they can look at some earlier stage data and perhaps have some intuitions or sense of the way the reactions are headed. So you don't have to go all the way out to 2 years to know kind of where the trajectory is headed. So I think on some of our early models, we were able to kind of perfect the structure of the product. And so that once we got into the longer term models for our FDA submission, the product was fairly buttoned up and ready to go. But still, once we started the FDA studies, I think it must have been three plus years until we actually were able to get all the reports in place and get over that hurdle. So that was quite a significant hurdle. And I expect that any company coming up with a brand new novel technology these days is going to have to expect to have a fairly significant regulatory hurdle. And the advice that I would give in that regard, because there's not really any shortcuts. If you try to take shortcuts, it's probably going to come around to bite you afterwards. So I wouldn't recommend shortcuts. What I would recommend is keeping a very tight control of expenses during that period. Keep the team down to a minimum, just the people you need for that effort. We were trying to get a little bit of a jump on the commercial rollout. And so we already hired some people when we first expected to get the clearance. And that was a lot of money out the door when it ended up taking quite a few months longer than expected. And so even though it's nice to be able to get the jump on it and you would really want to be prepared, it's a lot of risk to bring on those heads, especially if they're good people, good commercial people, need to be appropriately compensated. So I would just be very careful as to your spend before you're actually over that regulatory bar.
And is your product being used in the market today with patients?
Yeah. So we had that first regulatory approval. Now it's going back about a little bit more than 5 years. We had our real commercial launch March 2020, right into COVID, with our first hammer toe implant. And this year we're on track to do about $40 million. So we've grown nicely in those last 4 years. We're now active in foot and ankle surgery and also in sports surgery. So we've kind of expanded out a little bit. And every year we bring on a couple more products. So this is, as opposed to some companies that really have one product and you just kind of grow it out, we are a technology that we now have screws and threaded nails and anchors and small anchors and all kinds of other things. And so basically every year we bring a few more products online to expand the portfolio.
So clearly your products are, you're seeing a great response in the marketplace. Your fiber, your OSSIOfiber is obviously, the patients are having great experiences. I mean, what kind of data have you been seeing since, you've been starting the procedures?
Yeah, no, so that's a great question. So we actually internally prioritize what's called clinical evaluation, even post-commercial. And that's something that is sometimes stronger in other countries than the US. But we really try to track down every patient. And I would say that our success rate has been fantastic, quite significantly above what you would see in the literature for any of the procedures that we deal with. It's something I actually presented on recently at the biomaterial meeting. The most common issues I would say that people would have with OSSIOfiber would be just in terms of getting used to the new technique. It's not metal. It doesn't cut like metal. So sometimes, for example, some of our screws require tapping, and that's something that with a lot of other screws these days, surgeons wouldn't do. So you have to be like, oh, now you're gonna need to tap, and you got to kind of get their head into that. But overall, we've been very, very happy with the indications, and whenever there is something, let's say a surgeon for a certain procedure needs a different tool, a different size drill, or whatever it might be, we try to be very responsive to that and stay very tied in to the customer so that we can adapt ourselves and be able to give them the tools that they need to make the implants work.
And I just wanted to say that was such great advice you were giving before for other entrepreneurs who are listening in and thinking about, going through that regulatory journey. Clearly, every sort of process starts with a hypothesis, and you had an idea that you were trying to validate and pivoting through that. What have been potentially some of the biggest feedback or changes in what you thought at their origin? And, how have you used that to inform your go-to-market strategy to where you are today?
Yeah, wow. It's actually such a perfect question because we just had this discussion internally, and I have a very, very clear answer. When we started out, we thought we're just going to create a toolbox for the orthopedic surgeon. We'll create, 4 mm screws, 3 mm screws, 5 mm screws, and they'll take it from there, which is a great idea. But that's actually a little bit a older approach to how these guys work today. And in the way the market has shifted is that successful companies are owning procedures. So you don't just create a toolbox. You say, I'm going to give you absolutely everything you need to do a certain procedure. So that when you think of doing, I don't know, a tibial tubercle osteotomy, you're going to think Ossio, and you're going to have from Ossio the drill bit you need, the jig you need, the depth gauge you need, all the things you need to do this procedure, including the best-in-class implant. And that's where the market is going. You need to say, this is the procedure that I'm going to own. And so early on, we were not as aware of that as maybe we could have been. We had a general awareness, but we didn't realize the degree to which the market is shifting. And so now, over the past years, we've made a much stronger effort to identify specifically which indications we're going after with each product, and to make sure that we're actually providing the surgeon with what they need to do the surgery, so they don't have to call up a competitor and be like, oh, I really want to use the Ossio implant, but I need your drill or your jig, because then the other company will just be like, well, if you already need my jig and my drill, you might as well use my implant. So, I'm joking, but it's really the way that you have to think about things these days, is you need to be procedure focused every which way. And once you can own a procedure and give the surgeon and give the field confidence that you are the masters of that procedure, that's really the way to grow, in that procedure.
Yeah, again, more great advice. I think, often for first-time finders thinking about just that specific problem they're looking to solve, they're not really truly understanding the clinical workflow and all the other elements that go into that. And so again, it's a complex, process and a complex procedure that you're trying to address. And so there's a number of factors, number of stakeholders you have to think about clearly through that journey. Sort of moving on to that go-to-market piece, and you were talking about where you are now. Can you tell us a little bit more about, where do people get your products? Is in all territories? How are you thinking about that strategy? Are you working with distributors, or again, how are you approaching it?
Yeah, super important point. And that's in our panel. I remember Leslie saying that, entrepreneurs don't always think about that. They just think, hey, I'll bring a product and then I'll lob it over the fence to the big corporate. But actually, these days, that's not how it works anymore. It's not just make a technology and somebody's going to buy. People do want to see that you're able to penetrate the market. And the way that Ossio has done that has been in a couple of different ways. But our first field of foot and ankle is an interesting area. In that field of foot and ankle surgery, there's actually what they call independent distributors, or what's known as 1099 distributor, who in the different geographies, every different city or area, folks who see the foot and ankle surgeon and basically assemble a bag of different products to bring to that surgeon. So you're actually able to have presence in that market through these independent distributors. But it's only a partial solution because there's not one of those in every single geography. So we're actually now in a hybrid model where we have some of our own direct, what's called a direct rep, a employee of the company who sells your product. It's hard to do that in the early days because it is a fairly costly undertaking, but we do have some of those out in the field. And we also have these independent distributors, and they're all managed by our regional sales team. And so that's on the foot and ankle side. Now, sports, which is related, is also different because sports is really dominated by a few very strong players. And that makes it more challenging to penetrate. And that's where you have to think creatively, because some of our products address areas that some of the bigger players just might not have any product for. For example, subchondral fixation of knees is been a fast growing area for us. and it's just something that's not really, it hasn't been out there before. So nobody really has that product. So you might be a representative for a different company, but you actually can carry our product since you don't have anything that competes with it in your bag. So we have some of those, but the negative part about that is other products like a suture anchor, where they might already have from their home company, one of the bigger companies, they're basically not going to sell our suture anchor. So you're going to get blocked out of those accounts selling one of your most successful products. So that's not something that we're still working out and trying to optimize. And certainly as a smaller company, even if your idea is amazing, and even if you get over the regulatory hump, and even if you have great reimbursement, you actually still need distribution. And so that's something that I would say, even from day one, going out and talking to some of these distributors, these guys know what's actually going on out in the street, more so even than your corporate executives who kind of see things from a high level. You go into a couple of these representative geographies, say go Columbus, Phoenix, and you ask the guys on the ground, what's going on? What are you selling? What are you allowed to sell? Would this product compete with your portfolio? Is it complementary to your portfolio? Figure out where you fit in, because at some point you're going to have to fit into somebody's bag.
And Kyle, the big thing is there, you can't start thinking about go to market early enough. We hear this again and again, like knowing your reimbursement, knowing how you're going to get some money for this amazing product that you're trying to develop is so critical. There's just so much to be done, but I think it's a starting point for any first-time fighter, particularly. That's got to be the starting point. You got to understand how you're going to turn this into a sound revenue-generating business.
Oh, you're spot on, Richard. And Orahn, sorry, I want to jump in here because it's crazy. Here you are, approaching 40 million in revenue. I mean, you're quickly becoming, and you really truly are a very serious player in the market, right? You're seeing a lot of exciting growth. And Richard, to that point, I'm almost now more curious about, Orahn, how are you scaling now the go-to-market strategy? I mean, it's interesting certainly to hear how you've got to where you are today, but I think it's really interesting to hear, okay, well, what does that 40 to say 250 million look like,
Yeah, well, first of all, I have to give credit to our fantastic commercial team. Obviously, Brendan Murillo, who's our Chief Commercial Officer, is a total all-star in the field, and Mike, our VP of Sales, ton of experience in the space. So we put together really a top-notch team who has experience both in our specific space and in related spaces, and kind of has done this a couple of times before. As somebody who came from the ground up, I would say having guys on the team who've seen it already from the other side in billion-dollar businesses and have seen that road, it's just so critical. And there's so much that goes into it. Obviously, you could start from the operations side, just getting enough product into the field. It sounds obvious. Oh, we'll just mail it to everybody. But the logistical piece of that can be quite overwhelming. So that's one piece, and we actually manage that out of the Israel site. But we're able to work with partners in the U.S. to help on the logistical side. And in terms of managing the field, there's a ton of analytics that go into that. We actually have a full-time, sales analytics fellow who runs the numbers. And these days, you have access to tremendous amounts of data where you can see, okay, so we're targeting these procedures, coming back to our previous conversation about the procedures that you should be owning. Now you go out and you see who's doing these procedures. Where are they? Are they in Minneapolis or are they in Florida? And they're in Florida, Joe, but my guys are in Minneapolis, so I don't have guys in the right place. So as you go down the road, you have to keep kind of identifying where the holes are, where the procedures are happening where you don't have the presence. And then there's, of course, a lot of additional things that go into that, like account access and the nitty gritty on the more bureaucratical end. And those are areas where just, there's nothing like experience, and obviously working with people who specialize in these areas to help you overcome those hurdles.
So what about the next 12 to 18 months then? What is your primary focus?
Yeah, so OSSIO is actually doing kind of two things in parallel right now. On one hand, just growing the business, growing the existing business, both in the foot and ankle and the sports, in all the ways that I've described, more medical education, just we've just touched a tiny part of the market. So there's a tremendous amount of growth there. But I would say what gets me out of bed every morning is actually also the clinical development. We're doing a couple of just fascinating clinical projects right now, many of them around joint preservation and just doing things that haven't been out there before, that surgeons came to us and said, hey, I was thinking of doing this, do you think that will work? We'd be like, oh, that's, I don't see why not. It sounds very interesting. Why don't we do a study, look at a couple of cases, see what that's gonna come out as. And one of those projects right now in the knee space is actually about to have its first publication, and we're just super excited about that. And now we're taking that into a multi-site study and some other areas. So I would say, for me personally, it's really just seeing how we can advance clinical science almost to places where we haven't been before, almost a frontier that hasn't been addressed by existing devices. So going beyond building a better mousetrap for procedures that have been out there and into just a whole new level of procedure. So I would say that's what I'm most excited about. But in parallel, we're also moving into things like minimally invasive bunion, which, like Richard was saying before, a minimally invasive approach is highly attractive to patients. Doctors are adopting now at a great rate. And to be able to say, hey, not only is it going to be minimally invasive going in, but it's also going to be nothing left behind. I mean, it's like, for a patient considering a surgery who is, maybe even scared of having the surgery, now, like, what's there to be scared about? This is just, it's going to be a more comfortable procedure for them. So it's just a lot of stuff going on that, that is fun for OSSIO right now. And, that's why we do this, right?
Well, you guys, again, to Cal's point, you guys are doing amazing stuff. And what an exciting time for orthopedics with all that's happening right now in this biologic space. I wondered if we sort of finish here and we think about some reflection. And, clearly none of this happens without money. And you spoke about, how you transition from this earlier stage go to market, and you have this laser focus, and now you have a sort of growth, and you can sort of widen your lens and look at other use cases. How are you thinking about market trends? What are you seeing in that space, given all this recent transactions in the orthopedic space? And again, how are you handling that sort of conversation with their investors, where they're saying, hey, how are you thinking about all these opportunities? Because clearly a lot of, again, communication has to go down into how you think about that strategy and where you take that next step.
No, that's a great question. That's the strategic conversations that we have are really all around that. I'll give you a great example. I don't know if you've talked to this team yet, but there's another company out there called MIOC. They have this thing they call the barrier implant. It's for ACL repair. Our anchors are used very commonly in those repairs. So, our product is used with their product for a kind of a fully biologic repair. Very attractive, just, goes so well together, right? And you say, wow, what if I could just, bring together a couple of these companies, who each one with their own approach, but just in this new mindset of biological, all natural, and just make this the new way and go out there and push this as an entirely new direction. I mean, I personally find that very attractive. Obviously, the historic kind of model for these med tech companies is more, hey, you build it a little bit up, and then somebody comes and takes you out. That's kind of been the historical model, but in some ways, it's a shame that tends to happen, because there could be something very beautiful about creating almost a holistic new entity that could drive almost a whole new generation of solutions. So, look, the practicalities of the industry at the end of the day really will end up dictating where you end up, how strong the public markets are versus how strong the M&A market, where all these kind of macroeconomic concerns. But just in terms of the way the market is headed, besides for OSSIO, I look around and definitely see a lot to get excited about.
You've spoken like a true chief innovation officer and someone who wants, to continue innovating. And to continue building. You can totally tell, Orahn, that the passion is there. Where can folks find OSSIO or see you in action next? Where can they learn more? Let them know.
Sure. Yeah. LinkedIn is obviously a great place to connect, or through our website. We actually do respond to our contact us in our website. Are all good places. We also have presence on all the other digital platforms, whether it be Meta or Instagram, If you go check out Instagram, you can see Brendan's beautiful wildlife photos. But yeah, so no, we have a pretty good presence, and yeah, again, always happy to collaborate, whether it be on clinical research or on new initiatives. We do a lot of collaboration with various folks in our field.
Any shows coming up?
Yeah, so we'll be at the Academy, which is the Academy of Orthopedic Surgery, coming up in March. It's even though it's a lot of, I would say, most relevant academic work has shifted to the society meetings for the specific groups, the foot and ankle, the sports. The Academy is still I would say the biggest kind of industry get together. And then we will be at all the foot and ankle meetings and sports meetings this year, which also provide a good opportunity.
Well, I'm sure for anyone listening, they're going to want to take you up on that offer. Highly recommend head over to the website, OSSIO.io, learn more about this company. You guys are doing some fantastic stuff, I have to say. So just can't thank you enough for joining us today.
Yeah, no, thanks, guys. Thanks, Kyle. Thanks, Richard. Really appreciate it, and look forward to hanging out with you guys at the next one.
Awesome. Well, ladies and gentlemen, another huge thank you to our guest, Orahn Preiss-Bloom, founder and chief innovation officer of OSSIO. And thank you for tuning in to another episode of the MedTech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Beaglejohn. Until next time, keep innovating.